Mr. Speaker, thank you for that recognition. Thank you for this time. Mr. Speaker, over the past several weeks, I've been talking to my constituents. I've been talking to former patients about the importance of Medicare and how Medicare has impacted their lives, how they've relied on it. As a doctor, I've taken care of thousands of patients who have worked their whole life paying into a system so that they could rest easy at a time when they needed their health care. They wouldn't have to worry about it. This is a value and a program that has served millions of Americans for decades. They've come to rely on Medicare. It is a program that works. It is a program that we've come to rely on as doctors. Let me even make it a little bit more personal than that. Let me tell you the story about my parents who came here as immigrants over 50 years ago. My mom was a public school teacher. Dad was an engineer and a small business owner. They got up every day. They went to work. They paid into a system over a lifetime so that when they needed their health care, they could rest easy. They knew they had a Medicare system. Let me even make it more personal. Over these past few years, my dad's in his late 70s. He's needed knee replacements. He was able to get them. His doctor was able to order the care that was necessary to take care of him. A few months ago, my mom suffered a mild stroke. My dad didn't have to hesitate about whether she could get health care or not. My dad could pick up the phone, call 911, and get her to the hospital. She was able to get the care that was necessary that millions of Americans count on. Her doctor was able to come and see her. Her doctor was able to order the post-operative care that was necessary. That is why millions of Americans rely on Medicare, so they can rest easy at a time when they need that security of health care. It is a system that works. It is a system that working men and women in America pay into over their lifetime so that when they're at their most vulnerable, they're able to get the care that they need. I've seen it time and time again as a doctor. Let me even share one more story with you. As a young intern training in internal medicine as a doctor, one of my first patients was a Roman Catholic priest, Father Mike. It was my first month working in the hospital and doing my rounds in the intensive care unit. Now, Father Mike was afflicted with ALS, more commonly known as Lou Gehrig's disease. Father Mike would come in and out of the hospital and would be devastatingly sick. For those of you who know about Lou Gehrig's disease, it is a progressive illness that slowly deteriorates and eats away at your body. It takes away your muscles and your ability to breathe. So over the course of 2 years, I would see Father Mike repeatedly, coming in and out of the intensive care unit. He needed that care to keep him alive. Without Medicare, he wouldn't have been able to afford the care. Now let's ask ourselves as Americans, what are our values? Our values are that we take care of our seniors, that we take care of our parents and grandparents, and we want to honor them after a lifetime of work. Those are who we are. Those are our morals as Americans. And that is why I'm on the floor of the House of Representatives today to talk about how important Medicare is. Not only for my parents, but for parents throughout this country, for grandparents throughout this country, but also for that next generation that is currently paying into the system. And I'm not alone. My fellow colleagues in medicine care about this deeply. And with that, I would like to recognize my colleague, Dr. Raul Ruiz a fellow physician from California.